we're talking about identifying patients who may be at a higher risk for cancer. Dr. Pearson, we've all heard about the cancer gene, but can you explain how the gene actually can affect our chance of getting cancer?
Sure. It's not uncommon for people to have at least one or two people in their family diagnosed with cancer. However, sometimes it seems like certain cancers run in families. This can be due to lifestyle factors such as smoking or obesity, but in certain situations it can actually be an abnormal gene that would be the cause of the cancer being passed down from generation to generation.
So since many families do have family members with the cancer, how often is the gene actually a part of this?
Well, only about 5 to 10% of people with cancer have an inherited type of cancer. And in those families, there's actually a mutation in a gene that gets passed down from generation to generation that increases their risk of developing a cancer. So they don't actually inherit the cancer per se, they inherit a genetic risk for developing a cancer.
So when should I worry about inheriting a gene?
Well, there's certainly red flags that make it more likely that an abnormal gene might be the reason for the increased risk within the family. Things such as multiple people in the family with unusual cancers or very rare cancers such as stomach cancer, family members who have been diagnosed with cancers at a much younger age than we would normally expect, such as somebody with colon cancer diagnosed around the age of 20, having siblings within the family having childhood cancers, and people within the family being diagnosed with multiple cancers, such as a woman diagnosed with breast or ovarian cancer.
So before you diagnose yourself with having a genetic cancer or increased risk for a cancer that may be passed from generation to generation, you should take a careful look at the risk factors associated with that particular type of cancer. You'd want to look at how many family members you have that may have been diagnosed with cancer in the past, specifically what types of cancers they were diagnosed with.
Things like age of the diagnosis makes a difference, and whether or not it was recurrent or multiple cancers, like I said, within the same person.
So if I'm concerned about this, should I talk to my physician about genetic testing?
Absolutely. Anybody with a strong family history for any sorts of cancers should consider looking deeper into their familial genetic makeup. It can certainly help direct them for their future health care. If somebody would be concerned, I would certainly recommend that they see their health care provider and discuss this with them, and then they can be helped to determine whether or not genetic counseling or testing would be appropriate and how to proceed from there.
So I've heard that genetic testing is now considered a preventative service.
Well, it is. Now, that doesn't mean that it's necessarily covered or free, but it's certainly considered under the Affordable Care Act to be a preventive service.
Thank you, Dr. Pearson. Thank you, Dr. Ellison.
You're welcome.
North Fulton Hospital is proud to offer complete women's oncology services. If you have questions about your risk for cancer or would like more information about the cancer screenings available at North Fulton Hospital, dial 770-751-2600 and ask for a referral to a physician. I'm Micah Brown for Checkup for Chicks.